Good afternoon. I am Dr. Jayant Kelwade. I am consultant endocrinologist currently working at Alexis Hospital, Nagpur. Today I am going to tell you something about diabetes. You know that diabetes prevalence is increasing day by day, and the most important thing is many young patients in their 30s and 40s now developing diabetes, but they are not managed properly or diagnosed on time, and many times they land into the complications without starting on treatment. So definition wise, diabetes is a disorder. It is a metabolic disorder characterized by the increase in the blood sugar level, and it because of either insulin deficiency or there is a resistance to the action of the insulin. There are both types, means one type where there is a absolute insulin deficiency is there, and another type where there is a insulin is secreted in the body but it function is less to control the blood sugar level. So definition wise, it is increase in the blood sugar level, and there are four types of diabetes, that is type 1 diabetes, type 2 diabetes, the third one is diabetes because of the other reasons, and the fourth one is gestational diabetes, that is diabetes which comes during the pregnancy. So what is type 1 diabetes? Type 1 diabetes, it is because of the absolute insulin deficiency. This generally occur in younger patient, childhood patient, where there is a insulin is not synthesized in body, and that's why this patient develop diabetes. And because insulin is not synthesized, this patient has to be on insulin throughout their life. So there is no alternative. इसमें आपको दूसरा ऑप्शन नहीं है, आपको ये पेशेंट को इंसुलिन ही लेना है and जिंदगी भर लेते रहना है. Another type is type 2 diabetes that generally occur in adult patient, and in these patient there is a deficiency as well as there is a resistance. So initially there is a resistance to the action of the insulin, so that insulin get increased, but later on there is also less production of the insulin. So it is a combination of both. There is a insulin resistance as well as the insulin deficiency. This patient can be managed on tablet, and if there is a deficiency, then this patient also has to be on insulin. Another type is type 3 diabetes, that is because of the other disorders, like because of the drugs or any other pancreatic disorders. And the fourth one is the gestational diabetes, that is the important type, because if the mother develop diabetes during the pregnancy, it may have effect on mother as well as the child. So that condition has to be diagnosed on time and treated meticulously to prevent the complications in the children. So what are the symptoms of the diabetes? Diabetes, the classical symptoms which are described in the book for the diabetes are the polyuria, that is increased urination, polydipsia, that is increased thirst, and polyphagia, that is increase in the hunger, increased hunger. So these are the classical symptoms, and also apart from this there is the weight loss. So these are the classical symptoms described in the book. But nowadays, because of the early screening, many times these symptoms do not occur and patient diagnosed early. Other symptoms may be because of the complications of the diabetes, like if there is a neuropathy, you can have the burning sensation in the feet or tingling sensation in the feet, or if the patient develop any renal related or kidney related problems, there may be the decreased urine output. And another complication of the diabetes is the cardiac complication, and the patient may have cardiac symptoms. What are the complications of diabetes? The classical complications which are described for the diabetes are the acute complication and the chronic complication. Chronic complications are important, and these are the vascular complications. They are divided into two types. One is the microvascular, means there is a small vessels are involved, and the macrovascular complication. The classical microvascular, that is small vessel complications, are retinopathy, nephropathy, and neuropathy. Retinopathy means your eyes are affected, nephropathy is kidney affected, and the neuropathy means peripheral nerves are affected. While the macrovascular, that is larger vessels are involved, and the complications included are the cardiac complications like acute myocardial infarction or the chronic cardiac complications, stroke, that is paralysis, and also there is a blockage in the peripheral vascular, that is a peripheral vascular disease. So these are the classical vascular complications of the diabetes. Apart from this, there are many acute complications like type 1 diabetes patient may land into the diabetes ketoacidosis, that is a life-threatening condition and has to be treated on time. Another complications are the increased risk of the infections. So there are many complications and there is no single part of the body which is not affected by the diabetes. So every part of the body get affected by the diabetes, and that's why the diabetes is a important disease to treat on time. Then what are the how to diagnose diabetes then? Okay, so diagnosis is mainly based on the blood sugar levels. There are 3 criteria which is defined by the American Diabetic Association, and that include fasting blood sugar, 2-hour post glucose challenge test, and the HbA1c. HbA1c is a 3-month average sugar. So any patient having fasting blood sugar more than 126 mg per dl and the post meal sugar more than 200 mg per dl and the HbA1c value more than 6.5 is considered as a diabetes. While the fasting blood sugar below 100, the post meal sugar below 140 and the HbA1c below 5.7 is considered normal. And in between, like if the fasting is between 100 to 126, post meal between 140 to 200 and the HbA1c between 5.7 to 6.5 is considered as the borderline or pre-diabetic. This pre-diabetic group is very important because at the end I just want to suggest you that healthy lifestyle, healthy food and daily exercise, at least for 45 minutes walk, can prevent you from diabetes. Once you are diabetic, you have to be on medicine as well as lifestyle modification. So take your medicine properly, follow up with your doctor regularly so that you can prevent from the diabetic complications.